Hi dear YouTube, welcome back to my channel. So in this video, I'm going to be talking a little bit about my process for getting my job, interviewing, and all of that jazz that happened. For those of you who are new to my channel, my name is MelisaMarie. I'm a new grad registered nurse. I am a NICU nurse and I got my job straight out of nursing school. If you're interested in what I have to say, make sure you smash that like button, hit the subscribe button, and stay tuned for the rest of my videos. So I began my process of looking up jobs very early. That was more to do with the fact that I was losing motivation in nursing school above all, because I had hit a brick wall with my studies and with just everything in life. There was just a lot going on and I just needed a bit of a to push me through. And so I started casually browsing Indeed and Glassdoor and just Google jobs. I was looking up different jobs that was available for new grads, and I was mostly looking at like pay scales for different states to gauge like, okay, this is what I will be making eventually, this is what life is going to be looking like, you know what I mean? Then I happened to come across some listings for the NICU. So at that point I had determined that I want to be a NICU nurse. So seeing those postings, I was like, okay, let me like dig deeper into this. This is all the way back in January now, mind you, January 2022. I had still 7 months before graduation at that point. But the jobs that I was looking at was hiring out for July, August, September, October, and December. I had no idea before my casual searches that there were hospitals that were hiring that far out. But now I understand that there are certain hospitals, especially if they're like a big name hospital, like a University of Pennsylvania or like an Emory or like a Johns Hopkins or MedStar, Georgetown, GW. These hospitals, they hire very, very far in advance for the residency programs. If you're just like trying to get a new job and you already are a nurse and you already have experience, this is a different video. Looking at my research, I saw that I missed the deadline for 2 hospitals that I was interested in the DC area. And I was like, damn, who would have thought to be applying to jobs? Like at this point, I'm trying to get the community, like what? I had to quickly apply to some jobs at that point. So what I did was spend like a day or two revising my resume, making sure it was up to par. And my resume has my experiences from the last 5 or 6 years on there. So I don't have anything from high school, just anything from college. So from my first degree and from my second degree and anything in between as well that's relevant to the specialty that I want it to be to. Make sure that your resume is on point. Everybody can file an application. Anybody can say woo woo, wait, an application. But your resume is really going to set you apart in terms of like, oh, okay, this is popping out, this is popping out. Like it's gonna grab their attention. And if your resume is not on point, you'll be put in the trash immediately. I made sure my resume was good and I uploaded it to different systems and I just went ahead and started applying. And I applied to like every NICU job that I could at the time. I also applied to other specialties as well. A lot of hospitals, I applied to their oncology unit because that's where I had my experience. I applied to their emergency department because I had experience. Having that experience kind of helped gateway me into certain hospitals. So there would be times when I would get phone calls from recruiters and they would say, oh, I see that you have oncology experience on your resume. I have these oncology jobs open. Are you interested? And I would either say yes or no. So initially I would say yes because I did have an interest in oncology for a period of time. And I wanted to get my feet wet with interviewing with specialties that I wasn't super interested in at first, so I could understand the process and get used to it. And so I would be like, yeah, I'm interested in, I would interview with these companies. Sometimes those recruiters work for multiple specialties. So once you get to know the recruiter and they get to know your work ethic and they get to know your style, your professionalism, then they can help you get further along into a different specialty. So one of my recruiters, for example, she had offered me a job for oncology in the bone marrow transplant unit. And I did not accept initially. I don't recommend accepting a bunch of jobs and then declining them as you go along. That's a little ghetto. Don't do that. But I had the job offer sitting for a while and I just told her like I need more time to make my decision. For one, I didn't want to take away an opportunity from somebody else. And also you don't want to waste their time. Like I let her know I need more time to decide. She wanted me to decide in like 5 days. I was like, girl, it's February. I'm like so far from graduation. Like I need like 4 or 5 months. And she was able to oblige. But in the meantime, once I decided that I was more strongly aligned with being a NICU nurse, and that's really where I wanted to be, I told her like, hey, I don't think that this specialty is right for me, but this is the specialty that I'm interested in. If you have any connections, you could please get me in contact with the person who does take care of that unit, then I would be very grateful. And so she, connected me to a NICU recruiter. And she said, oh yeah, I work closely with so-and-so person, and voila, there I have my first, connection into the NICU. And so with that, I was able to land a part 1 interview with the recruiter, a part 2 interview with the assistant nurse manager, a part 3 interview with the nurse manager, and a part 4 interview with a few nurses on the unit, senior clinical nurses, and another assistant nurse manager. Through those steps of interviewing, I was able to get offered my job, and the rest is history. So that was like a general overview of how the process went for me. I was offered my job back in February of this year, and I had started the process in January, like I said. Now, between February and when I actually started, which was shortly after my graduation, definitely had a lot of things come up that was unexpected. I had to push my start date back a little bit, but that's not something that you have to worry about. Some people have a little bit of anxiety over that, and I'm just giving you my experience, which is to say, as long as you keep a line of communication open with your recruiter, it will all work out just fine. And so that's what I did. I talked to HR and just kept things open with her, and it was pretty much okay. As far as the interview tips specifically, I would say is 1, to research the company for sure. So for me, I would make spreadsheets and say like, okay, these are the companies I'm interviewing for. This is the company's motto. This is the company's mission or their statement. And whatever it is, like if it's like to save the most lives ever, then at some point in my interview, I'm going to use that mission statement. I'm going to tell them, yes, because my goals is to save the most lives ever. And I feel like I could do that with state hospital. You know what I mean? You want to make them feel like you would be the perfect addition to the team. Research the hospital itself and their mission statement so you can get to know the direction in which they're moving and the type of employee they're looking for. To make sure you dress professionally, all of my interviews except for 1, all of them were virtual. But even still, I had my suits on, my blazer, my white shirt, I had the whole professional getup going on because you want to present to them that image of professionalism. First impressions really matter, and you cannot take them back. You definitely want to cast on them a good first impression. I would say prepare some questions to ask them. So it's wonderful that you can answer all of their questions, of course, but it's really impressive to a lot of companies that you ask questions back. So some questions you can ask back, it don't have to be anything like snappy or super detailed, but like if I'm interviewing with like someone who works on the unit, I will ask them, well, hey, like what has made you stay on the unit for the amount of years that you've been on? You've been on the unit for 30 years? Why? What kind of person do you think would make the biggest asset to the team? What's a day that you've had that's been really difficult at work? Like I'm asking them, I want to know for myself too. Because you got to remember, when you're interviewing, it's not just for you to get the job. It's also for you to feel like you fit in with that unit. Because ultimately you want to be somewhere that you're happy, where you feel supported, and where you feel that you can thrive in your career. I'm asking all the questions that I can. Number 4, I would say, is to develop a story bank. When it comes to answering their questions, they really like it if you can paint a story with what you're answering. One of the questions that I got asked probably in every interview was, name a time where I went above and beyond for a patient. I've done this many, many times, but when somebody asks you on the spot, sometimes you'd be like, damn, have I done anything at work? And you don't really know what to say. So I sat down one day, like shortly after fixing my resume, I just sat down and wrote out a bunch of different like little story blurbs. Like, okay, there was the one patient who needed to go to the cath lab because he was having heart problems and he ended up having a heart attack. Or there was the one patient who didn't speak no English and I translated for them for the whole shift. Or there was the one patient who got a new cancer diagnosis and they didn't know how to handle it, and I was able to help with them bridging the gap. Like, you just sit there and think about all of the different things that you've done that has been above and beyond, quote unquote, for your unit, for your patients, for your nurse manager. You'll be able to pick from that, pick and pull which stories fit with what when you're getting asked questions during your interview. And those kind of things really help hiring managers to see how you are as a person and an employee, and how you will be helpful or harmful to their team. Another tip in general overall, as far as interviewing for jobs, I would say it's a good idea to investigate specifically the cities that you would want to live in after graduating. Some companies are not on Google's job search, or they're not on Indeed, they're not on Glassdoor. So I would look like new grad NICU residency, new grad NICU jobs, Google searching them or Indeed searching them, and some things will pop up. But then if I picked a specific hospital, like let's say I picked Jefferson Hospital, I would have to go directly on that website and go to their careers page and then search NICU grad residency, and a whole bunch of things will pop up that wouldn't come up before on Indeed or Google. So some companies are special like that, where they don't really have their postings listed on like a public funneling website like an Indeed or a Glassdoor, and that may just be because they're so popular, or because they have such a high regard, like they have a high esteem, or they're so sought after. They don't need one of those websites because people are going to go to their website to find these jobs. So I would say, like, make a list of all of the companies that you would be interested in working for and checking their individual jobs, like go on their career page specifically to find and apply for jobs. Also, make sure that your recommendations are on point. Make sure your references are people who can speak very highly of you and speak of you in ways in which they can tell your future potential employer that you would make a great asset to the team. You don't want to put anybody for your reference who's going to like just be very generic about your abilities, who's not going to paint the picture of, damn, that is an excellent worker, I need to hire them now. Do you know what I mean? Also, I would also recommend doing a working interview if possible. I did several working interviews, which, you know, you do your regular interview portion and then you spend like 2 or 3 hours on the unit working, quote unquote. And so you get to do some things that you would do as a nurse. You get to talk to the employees who will be your future coworkers. And that's really nice too, because you get to get a feel of the flow of things. You get to get a feel of how the workload is, what the ratio is like between nurses and patients, if the CNAs or techs are helpful at all. Like, you get to get a good flow of everything in that time period. And there's no obligation. Like, I've stayed as little as an hour and as long as like 5 hours, depending on how I like the unit. Now, to answer the question of how was I able to get a NICU job straight out of nursing school, it's a little bit tough because there were several jobs where I applied where I was doing really well in like the screening process. But then they would ask me like, which hospital did you have your NICU practicum in? And as a Chamberlain student, we didn't really have a practicum. Like, in our capstone course, we got assigned to clinical and stuff, but we didn't get to choose like, oh, I'm interested in this specialty, can you put me in this like specialty for my last clinical? That wasn't really a thing for us. So that kind of set me back in a lot of different ways, which is something to be aware of if you attend Chamberlain. Some jobs really look for that practicum experience before they hire you into a specialty unit. But I was just able to sell myself because I know what it takes to be a critical care nurse. In theory, right? I know that you have to be super sharp with your thinking. You have to think critically. Obviously, you have to be able to recognize signs and symptoms of patients declining. Like, I just used all of the experience and knowledge that I gained from like complex critical care when I was in that class, or adult health 3. And just things in general that I knew, like, yes, I know that this is going to be, I know to expect to see this. I know what to do in this situation. If a patient's blood sugar is X, Y, and Z, what do I do? Like, I knew what to do in certain emergent situations. And so I was able to sell myself to say, yeah, I've never had a practicum in this, but I am ready to go. I'm a fast learner. I am very intelligent. I am proactive. I'm responsible. I will hit the ground running. You will not have to ask me twice to do anything. In fact, you might not have to ask me at all. I will do it myself when I see that it needs to be done. Do you know what I mean? So I'm overselling myself at this point because I want them to leave the interview thinking, damn, if we don't hire her right now, somebody else will. That's going to be our loss if we do not hire her right now. And that's really what it was. That's really what it was. So with my interviewing process overall, I applied for probably like 100, 150 jobs. I got offered a majority of them. The most bizarre job that I applied for was a prison job. It was a nurse in a prison. So in that system, there was like an LPN and an RN, and they had split responsibilities and stuff, but overall I still was in charge of the LPN. But that job was paying like $80 an hour, guys, like crazy. But for me to be a new grad nurse in a prison, I knew that that was like very strange, because prison nursing is not like, that's technically like a specialty. It's not something that a new grad should be going in on. Though they said they had an extensive training process, I didn't think it would be smart at all to be like super new in somebody's prison. Like, it's given recipe for me to get killed on accident, and I really wasn't feeling that at all. So, but I went through the process anyway because I was curious about the requirements and the kind of things that, you know, they said that I would have to do. And it was actually a lot, which it needed to be for the amount of money that they were trying to pay. I still have my notes from that particular interview, and it was saying that there's 2 RNs in the entire jail clinic, and there's 1,200 inmates. The prison is twofold. There's a male side and a female side. There's an office for psych. There's an office for visiting providers to come in. A GYN doc come in. X-ray comes to the site. Ultrasound twice a week. There's a small lab, medical records. All of these things happen, right? And there's like also one NP who does exams as well. I'd be responsible for like sick calls. Whenever an inmate is sick, they come in and making sure I'm doing a full assessment and figuring out what's wrong with them, figure out if they need to be shipped out to a hospital or if they can be fine if you just, you know, send them back, take their vitals, get their chief complaint, follow the protocol document that they gave me, basically. I can prescribe meds, which is crazy as a new grad. If somebody needs antibiotics though, I would have to send them to a provider, which is weird, whatever. Of course, there's blood draws, there's insulin. A lot of patients in the prison system have diabetes, so that's a big deal, giving insulin. And you guys know insulin is not like a small drug to give. Like, that's a drug that kills people often because of overdosing or whatever the case is. So giving insulin, wound care, there's a lot of wounds that happen in jails. Like, they're all in close quarters, so you got to remember stuff like wounds, tuberculosis, like other like super infectious processes, they just like they leap from person to person because they're all so close together. So child it was way too much. Also, the RN also does pharmacy in a prison. So she was saying like, oh yeah, you're gonna be in the pharmacy area also. You know, there's 4 med cards. You gotta check the counts every day, twice a day. You gotta document everything. You gotta scan everything into the system. Vitals before and after you give meds, of course. Then there's like an actual med ward in the medical office where there's 6 to 8 patients that can be housed there for an extended period of time. It's given a med-surg unit. And then you're supposed to round every hour on these patients in the ward. I don't know how you think I'm around every hour and see 1,200 inmates. Like, honey. So anyway, she was telling me all this, and I was just like, this is crazy. This will be great content for a video, because what? Yeah, there was no way in hell I would ever do that as a new grad. I considered it for 3.5 seconds because she told me $80 an hour. You know, like, I had to think twice, like, damn, okay. But in reality, I value having my license way too much. I went through way too much to get this. I am not about to just throw it away for some coins, you know. That was just an example of one of the specialties that I interviewed for, but I've had several interviews. If you watch any of my mini vlogs, then you would have seen my interview processes, and I hope I answered your question and gave you an idea of how I went about my interview process in landing my dream specialty as a new grad. If you have any more specific questions, make sure you comment them down below or send me them in my DM or comment them anywhere in any video. I will see them. I hope that you enjoyed. I look forward to hearing from you in my future videos. I'll talk to you guys soon. Look more.
Just see those sleigh bells jingling, ring, tingle, tingling.